So you mentioned that it's very anti-inflammatory. It reduces stickiness of blood, help with kidney function. What do you think or the most striking benefits you've seen in your patients as far as, helping with people suffering from different conditions? Not that you're making claims that this can treat any of the conditions, but you've seen people with all kinds of conditions. And if they tried this therapy, did you notice anything that's really interesting?
Yeah, I mean, in the studies, we actually tracked their. So we did the blood work where we measured CRP, fibrinogen, SED rate, chemistry panel, and a CBC for white blood cells, platelets, and then the cytokine panel. So we have that objective data. But then we also tracked their subjective results throughout the course of the study, and mental clarity, energy, what we call drive, just like will drive, sleep quality, digestion, and pain. I believe those were the 6 that we tracked. Yeah. And interestingly, all of them except for pain. So pain, it was like it was split. Like 30% actually got worse, 30% stayed the same, and then 40% improved. So slightly more improved. That was the only one where it was kind of like a split. But all of those other ones, the mental clarity, the energy, the drive, the sleep quality, and then actually digestion, which surprised me because that was the biggest benefit. All of them either tracked as no improvement, but much more often than no improvement was improvement. And so, just speaking from like as objectively as I can about a subjective complaint, mental clarity, energy, drive, sleep quality, and digestion all improved, right? And for someone who's gone through mold or Lyme, like those, we think of those as being 2 of the bigger issues, more severe issues that affect probably all 5 of those. It's like they tend to feel better after doing EBOO. And so now we just have some data to not prove it, but suggest it, right? Because it's small studies. So 1,000 holes can be poked in our studies, but it's still the first of its kind.
Why do you think EBOO has gained so much popularity? What are people looking from it?
I think I wish it weren't so, but I think people they see a Ferrari and they want the Ferrari. I really think that's it. Right. Now, having said that, once you go do the Ferrari, you're like, it's nice, right? Like it works. So it's absolutely, it works. Like that's what we've seen. Again, we've had people fly repeatedly from other states, and people, that's all like the ultimate testament, right? People are not going to fly back to a little old family practice office in Glendale, California, repeatedly if something's not working. Right.
Yeah. And what are the range of patients you've seen? Do you treat very young patients?
That's a good question. I have always been reluctant to do what I would say is children. So it's pretty much like adults that we do. And it really has more to do with the parents. When treating children, it's more how the parents are. If they're super anxious parents, like it's a big deal to see that much blood outside, even though it's actually not that much blood. It's a big deal. It can really trigger this. It can trigger a vasovagal response, which is like, the people who are scared of seeing their own blood that faint. Like even if it doesn't end up being someone fainting, you can feel kind of crappy, right? And so that's kind of the most common side effect, if you will, is kind of like right at the beginning of the therapy. And it's really because it's because people are just scared. So their sympathetic system kind of goes on overdrive. And so we have stayed away. It's like we have other IVs that we can do in children where it's just one needle going in and maybe it's clear colored fluid, right? Rather than like this big old, what looks like a full on dialysis. So we've just stuck to adults.
Did you see any chronic conditions that responded really well to this treatment?
Yeah, pretty much any autoimmune condition, I would say. And it's interesting that the study suggested, again, it's a small study, but it's interesting that it suggested that pain wasn't affected, because I would say, like, anecdotally speaking, for the people outside of the study, I would say pain, if it's like from rheumatoid arthritis or just chronic osteoarthritis throughout multiple joints or throughout most of the body, like, it seems to really help. It helps a lot with mental clarity also. So for those folks with brain fog, that's another huge one. Brain fog will, from name the condition, there's so many reasons someone could have brain fog, but it helps tremendously with that. It's like this, most people report this sense of clarity afterwards.
What about things like Crohn's or ulcerative colitis also?
Yeah, absolutely. 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 And that's, I think it's because, ozone affects what's called the NRF2 pathway, which it really gets at this antioxidant response elements. So what it does is it's this huge oxidation hit to the body, which too much oxidation is bad. It rusts things, right? So too much oxidation is bad, but a little burst of it kind of forces this counter response, which is ARE, antioxidant response element system, which then enhances our body's ability to make things like glutathione, which is our number one antioxidant. And then that can kind of fight, if you will, or counteract the inflammatory response that is present in Crohn's or ulcerative colitis. So it's like this really neat way. That's what oxidation therapy really does at the end of the day.
Okay, so autoimmune conditions. What about brain diseases, neurodegenerative issues?
Yeah, again, it helps mental clarity. So, and why is why will there never really be a one pill to fix Alzheimer's? Because it's really it's the leaky roof with 50 holes in it, right? There's a whole bunch of different reasons that somebody has dementia, or name some other neurocognitive decline, right? So it's always about, that's why I say you don't want to just rely on EBOO, because you want to be addressing at least the bigger holes, or as many of those holes as possible. But in light of that, oxidation therapy, EBOO being what I think of as the creme de la creme of oxidation therapy, it's going to do a huge number against inflammation, which most chronic diseases, most chronic conditions, there's a huge aspect of it that's just over-inflammation or a dysregulated immune system. Those are kind of go hand in hand a lot of times. And oxidation therapy done well fights that or counteracts it, brings balance to the force.